Good morning, students. Today I have taken 5 mark questions from the same the model question which is given by Kuhas. I hope it will be useful for you. At least you can listen and you can take the material as I told from the description part or from the comment part of this class which I will be uploading in YouTube. And what is the question which I have taken is, write a note, short note, that means it is 5 mark question. Write a short note on herbal drug interaction with reference to pepper, they have asked. So we have to tell about what is drug interactions and herbal drug interaction, what are the possibility of drug interaction, because you have studied in detail about drug interaction in your pharmacology and you might have come across various medicinal activity also in medicinal chemistry. So these all things we have to include and we have to conclude, and so that the question will be very much feasible and also it will be useful. That's why I made some interesting definitions which will come under in this question. So we can go into the question about what they have asked. Again I am reading, please come to the point. That is, they have asked, write a short note on herbal drug interaction with reference to pepper. That means pepper you can emphasize. Other than that, we have to tell with the details about what do you mean by drug interactions. So initially, mechanism of drug interaction, we can say that drug interaction can occur in several different ways, starting from absorption up to its elimination from the body. As we have seen how you have pharmacodynamics and pharmacokinetics, especially pharmacokinetics, and even in dynamics also. I have given example, this is about only the kinetics, but even dynamic also having various influence with the receptor sites also, we can find sometimes drug interactions in our drug list. So the following are the various mechanisms by which the drug interaction takes place. You can see that. What are the mechanisms in which you can see very clearly types of drug interaction. One is drug-drug interaction, drug-food interaction, drug-disease interaction. So you see, drug interaction, two drugs, for example, even if you take a herbal drug and a normal drug, something which you are having another disease which you are taken drug, that also have interactions which you should know. And drug food, what are the foods you are taking normally, sometimes they are also having lot of interactions. And sometimes disease which already you have and you are taking drugs for another disease, that is also having interactions. So we are having, this is the type of interactions. Apart from that, dynamic, pharmacodynamic interactions, kinetic interactions inside the body can also be seen. Many types of variations are there. All I have included here in short form, and your basic knowledge which you have in your pharmacology, you have to use it for your understanding and for your general knowledge for your future as a pharmacist, to explain when somebody asks certain doubts and questions, and you can counseling also, you can make it very clear if you have and if you are thorough with your knowledge in the pharmacy. And you see, drug-drug interaction, first we start drug-drug interaction. More the medication administered, greater is the chance of drug interaction with each other. What do you mean by more the medication administered, greater is the chance of drug interaction with each other? And one drug may potentiate the activity of another drug. So this word you might have come across in pharmacology, potentiating, synergism, double the action or triple the action, addiction, action, synergism, you might have studied, antagonism, synergism. So these all are suppressing the effect, increasing the effect. So you can say potentiate, increase, potentiate the activity of another drug when you are taking together, or inhibit the activity, or seriously unexpected side effect also. See, for example, I have not mentioned here, previously if you see the journals, now the drug is itself, it is not available in the market because it has been burnt. Both the drugs, but ketoconazole is still existing as an antifungal. See, when somebody is prescribing, that is, we have seen that prescribal error also we used to say, that is also one type of interactions which you might have studied in pharmacology. So when you prescribe ketoconazole and acetamizole you may be knowing that it's the new second generation of antihistamine drug. So acetamizole, if somebody is claiming with a physician, that is, I have itching as well as I have the fungus antifungal ketoconazole, if he prescribes together, you say it will cause cardiac arrest immediately. The patient will be in a big trouble. So there are drugs which have uses in a same disease or in a particular disease. Sometimes it is possible to mix up them and it will cause a great damage to the patient due to its interaction. So drug interaction study is not only for the synthetic drugs or not only for it is necessary for you to know about herbal drugs also. They may also have this type of interaction. So patients have to be advised properly by the pharmacist or the physician in this regard, how to take the drug, how you can explain the things to the patients, how you can give a bold enough to give an advice to the patient once if you have the proper knowledge, backgrounds. So read every day, update your knowledge, read every day, update your knowledge, day to day, what is the various drug formulations, various drug interactions, various papers which have been published in the internet. You have no internet facilities. When we studied, there was no internet facilities. Now you have lot of internet facilities. Anytime you can see the internet and you can go for reference and you can study about the latest news about the particular drug which have what all the interactions. So you can expect all these three. It can increase, it can decrease, and also unwanted adverse effects or side effects can also be obtained. Suppose if you are mixed up with two drugs. So there is an example I have taken, that is Vicodin is a painkiller or is an analgesic, simple drug. When taken along with sedative or sedating, why I told it's H1, it's actually H1 receptor antagonist, which is like chlorpheniramine maleate. This all comes, diphenhydramine, this all comes in the first generation. So which they cause sometimes sedation, and they cause sometimes some sedation they used to give. But the second generation, like cetirizine, some people they used to have some sedation even when they take cetirizine. But cetirizine, all these drugs comes in the second generation which doesn't have any sedation. But this type of Benadryl contain especially diphenhydramine, or it has CPM, chlorpheniramine maleate. When it is given along with this painkiller, Vicodin, what happens? It produces addictive effect. It produces the addictive effect of drowsiness and sedation to the patient. And the patient will be uncomfortable to take that particular drug. When he has a headache or a pain, and as well as when he have some cough, dry cough. So in that case, when you are giving Benadryl with Vicodin, it causes this type of interaction to the patient. And also when you see the herbal drugs, example, St. John's wort affects the clearance of numerous drugs. St. John's wort is a herb which is having lot of activity and lot of uses actually. And when you are adding with this herbal drug with cyclosporin, antidepressants and digoxin, if you add these type of drugs, cyclosporin, antidepressants, digoxin, when you add these type of drugs, they causes lot of clearance effect, elimination effect, and they will increases the activity of the particular drug which is not needed, so that the dose will change and the regimen will change for the treatment. Salvia miltiorosia or miltrosia or miltiorosia, you can say, may enhance anticoagulant activity and bleeding among the people who is taking warfarin. You know, warfarin is an anticoagulant drug. Usually it is used in the various treatment, warfarin, anticoagulant drug, sometimes who is having sometimes cardiac activity and cardiac block, or some who is having expected sometimes block in the vessels due to sometimes cardiac arrest may be expected to do, so that they may given warfarin in some cases, so that will increase the anticoagulant effect, thinning the blood flowing through the blood vessels. So in that case, when you are taking along with the plant Salvia miltrio or miltriosia, when you are giving this Salvia plant, what happens? It enhances the activity or the thinning effect, blood thinning effect, or anticoagulation effect of the warfarin, and increases the bleeding in the patient. So, allium sativum, garlic, has also having found to decrease the plasma concentration of sacubitril, a drug which is used for HIV patients, antiviral drug, and may cause what it is causing? Hypoglycemic or hypoglycemia may causes, decreases the blood glucose level. He may faint. The next plant, Jinko, or you can say Jinko biloba. Jinko biloba, it's also very famous drug. Jinko biloba can cause bleeding when combined with warfarin or aspirin. So when you combine with these drugs, specifically cardiac congestive failure patients or cardiac patients, they may be prescribed with warfarin, aspirin. So this, when it is taken along with plant or a herb, Jinko biloba, which causes bleeding, which increases the activity of the anticoagulant action. So this I have just to show you what is St. John's wort. St. John's wort is a synonym for the plant Hypericum perforantum. Hypericum or hypericum, you can say. Hypericum perforantum, known as perforated St. John's wort, is a flowering plant, and its family Hyperaceae. And what is its activity and benefit? You see, it's an impressive health benefit drug St. John's wort includes its ability to treat depression patient, improve mood swinging, relieve anxiety. Anxietiness can be relieved. Reduce the severity of premenstrual symptom. It's very cost. That is, for example, premenstrual symptom is nowadays having most of the females, especially young females, they have this premenstrual symptoms. So this can be treated by this plant. What is that premenstrual symptom? That is most of them might have experienced that, especially just before the first stage of the menstruation. The females will be having disturbance in their mood disturbance, unstable mood, softening of the breast, and they may have even depression and aggressive, sometimes no interest in taking food. These all things sometimes happens as a premenstrual symptom. There is severity. So that can be treated by this plant. And easy addictive effect tendency, regulate hormonal activity, prevent cancer, and protect against viral infection, reduce inflammation, and nervous system also. You see, Suti, the nervous system, stimulates the nerve. So it has lot of pharmacological activity. So that's why we have taken this when they are given along with warfarin, it causes lot of drug interaction. And you see, now the next plant which we have talked about, Salvia, Malturiza, family Lamiaceae. You see the flower, a beautiful flower of a violet color flowers which is twinkled like this. And Salvia Malturiza, also known as red sarch, it's a Chinese sarch plant, dancing, and it is a perennial plant in the genus Salvia, highly valued for its roots in traditional Chinese medicine. They are using these roots of this plant in traditional Chinese medicine, highly useful. And it has been historically used in China with efficacy to treat heart disease such as angina pectoris. One who is having angina pectoris, you know angina pectoris, chest pain due to lack of oxygen supply to the muscles of the cardiac muscles, which can be, we know that you might have studied in the pharmacology by sublingual tablets, by using sublingual tablets with nitroprusside or by means of various nitrites. When you keep, immediately it will relieve. The nitrites which have the efficiency to reduce the requirement of oxygen in the muscle, cardiac muscle, so that it will relieve the angina pectoris. So this Salvia plant, Salvia species, especially Malturiza plant, a root, especially in China, they have been using it for angina pectoris and has recently shown efficacy in cerebrovascular disease also, and hyperlipidemia, and essentially circulation ailments. That is disease which is related to circulating difficulties, of blood circulating difficulties. These drugs, Salvia Malturiza, is more commonly used in China, and as well as its whole world. It's approved, it's in journal published, and very much useful drug. So this drug also, when you are mixing up with aspirin or with warfarin, it causes drug interaction. That's why we took this plant as an example, and I am giving the details of the plant. How interesting to know about the plants, you see. These all examples you have to come across, and when you are writing exam also, you can mention the drugs, the name, at least you can remember, and you can write what is its interaction with various other drugs, what is its pharmacological action, what you may be interesting to know about some of the things which is very much helpful for the patient who is using without the proper knowledge. So when you have some knowledge and improve your latest things whichever have about the interactions of the drug, it will helpful for you to advise the patients who is taking drugs along with herbal medicine. Jinko, that means Jinko biloba. Jinko biloba, commonly known as Jinko, or you can say even spelling Ginko, you can pronounce Jinko. Okay, 2 times I have written Jinko, and you can say they are called as Jinko. G you can add, or without that you can KGO also can be added. So family Jinkoaceae or Jinkoaceae. See the plant, it's a shrub. It looks like our Christmas tree which is grown in our house. Some of the houses they used to have in the garden or in the entrance of the most of the place I have seen. When you walk around in Kattapana, you can see not this type of plants, many, especially in Idiki district. And this is a very good plant and very good useful medicinal use. Jinko biloba has been used in alternative medicine. You know alternative medicine, CAM. That is complementary and alternative medicine is a parallel medicine which is from the conventional medicine which we are dealing with a plant source, animal source, mineral source, and in a crude form, and also which is proved as it's a parallel to the conventional medicinal practice everywhere. In European countries, CAM is the main thing. 80% of the people are depending on CAM. That means complementary and alternative medicine. So this is an alternative medicine. This is a traditional medicine. Alternative medicine has a possible effect in improving mental function. It can be used for psychotic, antipsychotic drug, and also it improves the mental function or treating anxiety, dementia, leg pain caused by blood circulation problem, and premenstrual symptom. This also can be used for premenstrual symptom. Just now we discussed about premenstrual symptom, which is usually it happens in young females, like various symptoms like disturbance of their mind and getting irritated, depression and softening of the breast, and these all of the things which is happening always in their menstrual starting stage or first stage. In that case they can go for this type of herbal treatment to get completely clear. They will be relieved from this type of tensions. And vision problems, even vision problem caused by glaucoma or diabetic patients, and vertigo, dizziness or a movement disorder. That means on a movement disorder, tardive dyskinesia it is called, a movement disorder caused by taking certain antipsychotic drug. Sometimes when antipsychotic drugs, sometimes some people will become fatigued, and sometimes they will become a movement disorder. So this can be treated by means of this Jinko biloba. And now we are coming to the second one, drug-food interaction. This is another type of drug interaction where drug interact with food, beverages, and can produce various side effects, some foods. Especially grape juice, you see. Grape juice reduces the enzyme activity in liver. It reduces the enzyme activity in liver. So that's what we have to see that, for example, you see, it reduces the activity in the liver which are responsible for metabolism or metabolizing drugs. thus resulting in increasing blood level of certain drugs such as cholesterol lowering drugs, statins, lovastatin, rostatin. There are many statins are there which is used for lowering the blood cholesterol. So this leads to toxic effect of the drugs such as muscle pain and muscle injury may cause because of this increase and the metabolic. That means it is when you take grape juice along with any type of this cholesterol lowering drugs, what will happen? It is responsible, it is lowering the metabolic level of the particular drug. So the drug will retain and it will maintain the minimum effective concentration in the blood, and so that it leads to very toxic effects like muscle pain and muscle injury may also caused by means of grape juice combining with any type of cholesterol lowering drugs, especially statins. Drug disease interaction. Sometimes some patient will have another disease and you are giving some other drugs and they may also having influence in the certain interactions. What is that? Sometimes drug also interact with certain disease where the disease alter the way of drug works. How the way of the drug works will be disturbed. It alters by means of certain other drugs and herbs when you are taking. Oral decongestant is an example which is commonly. Oral decongestant. What do you mean by decongestant? Decongestant means, congestion means something which is blocked. So when you have a nose block of the sputum or something which is blocked, what will happen? You cannot breathe by means of nose, you will use your mouth. So in that case you have nasal drops, that is pseudoephedrine, phenylephrine. These all are present in various nasal drops. You can see the nasal drops, what is the content? Pseudoephedrine or oxyphenylephrine, like that they might have written. Many drugs are available. But anyhow, all of them are used for decongestion. They will open your blocked nose by means of acting in the blood vessels, the decongestions, by means of acting on the blood vessels, peripheral blood vessels. So, may increase the blood pressure and can dangerous in patients having hypertension. Sometimes a patient is having hypertension. If he takes these drugs, it may cause increase in the blood pressure. Hypertension may occur in the patient already having hypertension. The increased blood pressure may be increased due to usage of this nasal drops. So, patient history and what is the disease they have. If the patient is having hypertension already and he is in drug treatment in hypertension, he should not be used. He cannot use these type of drugs for oral decongestants or even nasal drops. Here I am talking about oral decongestant. Especially nasal drops may not much disturb, but somebody who takes in oral drugs which contain pseudoephedrine or phenylephrine which can be taken in oral, already if he is having an hypertension, then it will increase the blood pressure and he will become in worse condition. So you should be careful. Now we are coming to pharmacodynamic interaction. So you might have studied about pharmacokinetics and pharmacodynamics. Pharmacokinetics means you might have studied what the body does with the drug. Pharmacodynamics means you might know what the drug does to the body. What the drug does to the body. So pharmacokinetics is disintegration, absorption, distribution and metabolism and elimination. But when you come to the drug dynamics, you might have heard the reaction after the drug entered into the blood. What is the drug does to the body? What is its, how it is action? How it is interacting with the receptor sites? How it is reacting with the protein binding? How the action takes place to the site of the action? This is what you might have studied. So there also sometimes interaction takes place. Drugs will have when they are combined with drug interaction and or the drug with herbal interaction can also occur. So what is that? This occurs when two or more drugs administered together acts at the similar receptor, same receptor if they are having action, leading to enhancing the action. You see, one example, additive or synergetic, multiplying its action, effects or decreasing antagonist effect also can be happen. Because the same site, receptor site, they are going for the action site. So example, chlorpromazine. So whenever I am telling the drugs, you should remember the pharmacology what you studied. Chlorpromazine, what is chlorpromazine? Chlorpromazine. What is the use of chlorpromazine? It is an antihistamine. It's actually a H1 receptor antagonist, but it has more action in CTZ. You can study the pharmacological reactions and when you read, you will understand. It's having action in the CTZ receptor which causes vomiting. So that's why it is added in the avomine tablets. So chlorpromazine, and there is another drug also you might have studied, especially in your medicinal chemistry, chlorpromazine and promethazine. What is the difference between chlorpromazine and promethazine? Like that you might, or chloromazepine, like that you might have studied in 2-3 drugs. One is used, some small difference. This is chlorpromazine. Gives a prevent nausea and vomiting interaction with, this is chlorpromazine. I am talking about chlorpromazine, which is a psychotic drug. So interacts with antipsychotic medication like haloperidol. When you are combining with this chlorpromazine with haloperidol and produces serious and possible fatal irregular cardiac rhythm. So chlorpromazine is possibility to combine with antipsychotic drug. Because you should remember what you studied in your medicinal chemistry. Especially you might have studied about 2 drugs. They have similar structure, only they change in the steric chemistry. Especially I am talking about, I told chlorpromazine, here it is written. That is promethazine is also there. Promethazine is used for acting on CTZ to control the vomiting. It's an antihistaminic drug. This is psychotic drug. But they have a chemical structure similar. Only a small methyl group, just a steric effect. Steric, the position of the methyl group will be changed. But the molecular formula will be the same. But you see the pharmacological action is completely different. Promethazine is used for as an H1 receptor antagonist, which causes suppression of the vomiting and nausea, which is included in the avomine tablet. You can just check it. And when you see promethazine, what is mentioned here is an antipsychotic drug. So when this psychotic drug, which is given with another antipsychotic drug like haloperidol, what happens? It seriously causes vomiting, nausea, and it gives a prevent, for example, give to prevent for any type of interacts with, it can interact. So you have to mention this, there is some small difference in chlorpromazine and promethazine. Both of them are having promethazine, chlorpromazine, and also these 2 drugs you have to just have a reference, but they have influence with certain antipsychotic drug like haloperidol, and they causes irregular cardiac rhythm. So what about the same thing can happen even with the herbal drugs also. So we have to think about, I have given some example, but we have to focus on piperine present in the pepper. That is what the important question which they have asked in this 5-mark question. We will discuss that. And what about pharmacokinetic interaction? Pharmacodynamic we talked about. It's due to the receptor sites, how they are, one of them, they have the receptor sites, how they are occupying the receptor sites, the competing with them each equally, that makes them to increase the activity or reduce the activity. So this occurs when the drug, this is pharmacokinetics. This occurs when drug interact during the process of absorption, distribution, metabolism or excretion. Absorption, interaction, in absorption, initial stage. What has happened? Some drugs alter the absorption. This, you know the reactions. Already we might have studied about tetracyclines cannot be given along with the milk. Why? Because calcium makes complex with the tetracycline and it disturbs the absorption of the drug. Very simple. And also milks cannot be added with many of the drugs. Antacids cannot be given along with many of the drugs. Like that. That is the example. Some drugs can alter the absorption of another drug. For example, calcium can bind with some of the drugs such as tetracycline and HIV drugs. Dolutegravir, that is retroviral therapy drug, antiretroviral therapy drug, and block its absorption. Hence, such drugs should not be given or should not be taken along with milk and antacids. And distribution interaction, drug distribution. About kinetics, we are just explaining in detail. One or more drugs can compete with each other for the plasma protein binding sites, resulting in replacement of one drug, thereby increasing its blood level and toxicity. So they are competing for the binding site and they causes increasing the concentration. Example, fenofibric is a drug which is used for lowering the blood cholesterol level. And warfarin, when they are joined together, and it is a blood thinning capacity warfarin, when it is given together, what happens? They are competing with the protein binding site, leading to displacement and increasing the blood level of warfarin increase and resulting to the bleeding. So you may be thinking about that. Why we want to give warfarin? So when you are giving warfarin, sometimes warfarin and cholesterol tablets, anti-cholesterol, for example, cholesterol lowering agents, when they are given to them, patients which are having sometimes chances of clotting inside the blood vessels due to clumping of platelets and are traumas, this thinning effect of the warfarin can reduce this type of heart attacks. Cardiac patients can be treated. So in that case, combining the drugs is very important. Knowing about drug interaction is very important. Educating the prescribers and the pharmacist is very important for drug interactions, especially in this area, in this internally what is happening in distribution sites also important. And metabolism interaction, next one I have taken enzyme. Sometimes metabolism, enzyme in the liver such as cytochromes are responsible for metabolizing drugs and eliminating them from the body. So some drugs may alter the enzyme level or its activity, resulting in fast or slow metabolism drugs. So you see, metabolism effect, what is happening? And sometimes these, for example, enzymes of the liver is responsible, that we know that, for metabolism. So some of the drugs, what happens? It alters the enzyme level. And it may be, and the activity may be differs, metabolism of the drug. May increase or may decrease. So for example, deltasim. What is this deltasim? You might have studied this drug, deltasim. It's an anti-hypertensive drug. But in detail you should know, not only anti-hypertensive drug, you might have studied various ACE inhibitors, calcium channel blocker. There are many drugs. This comes under calcium channel blocker, deltasim. It's a very important drug which is having calcium channel blocker. Anti-hypertensive drug. Even it can be prescribed for anti-arrhythmic also. Inhibits the cytochrome enzyme responsible for metabolizing. What? Inhibiting the metabolizing Symbast. This is vastin. Statin drug. This is also a drug which is used for reducing cholesterol, hypocholesterolemia drugs. And elevates the drug level, elevates the drug level. And what happens, you see? Serious liver, resulting in serious liver or muscle side effects can occur. So that's very important. You have to see that deltasim combining with statins. And you see excretion interaction also, excretion. While excretion also, you may be studied about nephrons, and you might have studied about urine excretion, where there is reabsorption and maintaining of the ions, and these all things you might have studied. So there also sometimes you are having interactions of the drugs when they are taking together. Some non-steroidal anti-inflammatory drugs, NSAIDs, that you might have studied. Many drugs, non-steroidal anti-inflammatory drugs, indomethacin is one drug which I have taken as an example, but you might have studied many. Like even paracetamol also comes, got all COX-1, COX-2, COX-3, like that you might have studied lot of mechanism of action of the analgesic drugs, especially non-steroidal anti-inflammatory drugs. So in that indomethacin I have taken, you might have studied many, ibuprofen, indomethacin, there are many drugs. In that, indomethacin is an example which lowers the kidney function and reduces the excretion of lithium. A drug used for lithium, which is a drug which is used for what purpose? It's an antipsychotic drug, bipolar disorder. In such cases, dose adjustment is required when you are giving painkiller. You should immediately take the requirement steps. And herb drug food interaction. Even though herbal medicines are obtained from natural sources, their active ingredients are potent chemical which can give rise to herb drug or herb food interactions. So herb supplements and nutraceuticals are purchased over the counter without prescription, OTC drug, and may be labeled as all natural, but when it is combined with other drugs, it can cause interaction, it can cause side effect. But that should not mean that it is always safe. Drug supplements are not subjected to review by FDA, and their use can often be risked when taken along with other drugs or food. So there are following instructions I have given, some of them with herbal drug minimize and given. Avoid taking mucilage for constipations. Ispagul is now a product which is available, Ispagul husk. You might have heard about, containing herb like Ispagul flakes. With other drugs, as mucilage can inhibit the absorption of many drugs. They can inhibit the absorption of many drugs. Even mucilage containing drugs can alter the blood sugar level, which have to be considered in case of diabetic patients. Spicy substances such as ginger, capsicum, etc. can enhance the absorption rate of some drugs. Hence, they need to be taken 1 hour after the drug administration. Hot tonic such as hawthorn, digitalis, catches, hawthorn, catches, digitalis, these all are some of them should be avoided when taken cardiac medicines. And you see, caffeine, coffee, containing herbs like green tea, cola, nut, coffee, and herbal stimulants like ephedra should be avoided when taking heart medication or cardiac medication or a mood altering drugs or antidepressants. Hawthorns is used for diseases of the heart and blood vessels such as congestive heart failure, chest pain, and irregular heartbeats. Hawthorn, what is hawthorn? You can see the hawthorn flowers, beautiful flowers, fruits is like this, and the plant will be like this. It's not in our area, and it's commonly called hawthorn quick thorn, thorn apple, may tree, white thorn, or howberry. Is a genus of several hundred species of herbs and trees in the family of Rosaceae family, native to temperate region of North Hemisphere in Europe, Asia, North Hemisphere, and North Africa and North America. Avoid herbs or formulation containing licorice, adimaduram. When used, diuretic. A patient who is taking furosemide, you might have heard about Lasix, furosemide, because the licorice can cause potassium depletion from the body. So what happens? Hypokalemia may happen to the patient. The patient will be in trouble. So licorice should not be given a patient who is taking Lasix. Lasix is a trade name. Furosemide, a diuretic. And while taking antidepressants like monoamino oxidase, MAO inhibitors like isocarboxide, siligilin. So these drugs, you should remember, these are very important. MAO. What do you mean by this MAO? Monoamino oxidase. You might have studied very detailed in. That means I hope in the pharmacology in the 2 or 3 you might have studied in detail. These all are the drugs which go and inhibit this enzyme which is responsible. So sometimes people will have sometimes depressions and they have psychotic problems and they have unnecessary aggravation, and all these things will happen due to the less of the neurotransmitter in the brain like dopamine, even acetylcholine. These all are which are present in the brain when they are less. Even you can see serotonin. These are responsible of neurotransmitters which is produced in the brain may be less. So you need some drugs which can reduce the activity of the inhibition of the monoamino oxidase. They are monoamines. I am talking about the monoamines of dopamine. These enzymes, when they inhibited by these drugs, their production, their need in the brain will be increased, so that the patient will be treated. So this you might have studied in your pharmacology very clearly. So these drugs, when you are giving along with African aphrodisiac drugs such as yohimbine is an alpha 2 receptor agonist actually. When you studied in your antagonist, I think you might have studied in your ANS. So yohimbine, which causes sometimes, it can be treated for erectile difficulties in male. So it can be given along. Suppose some patient who is having psychotic patient who is taking along with this MAO inhibitor, along with yohimbine, it causes sometimes very big damage and it causes sometimes difficulty in breathing. So it is necessary, it should not be combined to give these two drugs. And green vegetables of broccoli, spinach, cabbage, etc., which has high vitamin K content and reported to interact with anticoagulant like warfarin, heparin when it is given, vitamin K coagulant, and promote the effect of the anticoagulant effect. Bleeding may occur. And you see, grapefruit, already we have written about grape juice. Grape juice interact with calcium channel blocker also, like deltacin, antihypertensive drug, lipid drugs, lipid lowering drugs like statin drugs, psychotic medicines, many psychotic medicines, oral contraceptives, many estrogens, progesterones which is combined in oral contraceptives which is given, they also sometimes interfere with grape juice. And anti-allergic medications also. Grape juice modifies the metabolism pattern of these drugs in the liver. And now we are talking about the pepper, which is in the question also they have asked, you should mention about pepper. Pepper, nigram, very common, which we know that. In Tamil it is called milagu and it is Malayalam it is called kurumalagu. So you know very well it is tried and it's costly also. It's very much good production in especially in the hilly area. In Kerala also we have the more productions of pepper, nigram. Black pepper contain piperine. Piperine is the main constituent as a chief active constituent. It is used as a spice as well as carminative and to treat arthritis, asthma, stomach, that means stomach upset and sinus infections. And piperine is reported to inhibit various cytochrome enzymes and resulting in increased blood level of certain drugs like carbamazepine, midazolam, diclofenac, phenytoin and warfarin. So these all drugs you might have studied. Carbamazepine is an antipsychotic drug who is having unnecessary dreams and unnecessary is having sometimes is having in the bed or in the sleep unknowingly if he is for the human being if he is having ejaculation difficulties and some other, these all treated with carbamazepine in an antipsychotic drug. Midazolam, it's an anti-anxiety drugs. Diclofenac, which is very common, which is you can say it also comes under non-steroidal anti-inflammatory drugs. Phenytoin, anti-convulsant drug, and warfarin, you know it's used for anticoagulant drugs. So these all drugs, what happens? Resulting increase the blood level by means of inhibition, by means of taking place by pepper. So you should not take along with pepper when you are taking. Pepper nigram, that means black pepper might increase the risk of bleeding when mixed with anticoagulants or blood thinning drugs like aspirin. You see, blood thinning drugs, they are given a list. Aspirin also it thinning effect. Clopidogrel, you might have heard about clopidogrel. When you see cardiac patients, they will be prescribed, especially a person who is having sometimes minimum one time emergency cardiac attack or something. If you go to clopidogrel is a drug which thins the drug by how? Mechanism of action you might have studied very clearly in your pharmacology. Especially it goes and acts in the platelets, sticking of platelets in the blood, and they causes sometimes clot or thickening the blood due to that. So that time when you are using this clopidogrel, it will just prevent the binding of platelets. Heparin, you know, it is an anticoagulant. Warfarin also they have anticoagulant. A small difference in their activity which doesn't allow for the fibrogen formation. So they will prevent blood clot and blocking of heart attack. Emergency can be treated, but pepper if you are using along with them, they increase the risk of bleeding. They increase their activity. They increase the activity by means of inhibiting various cytochrome enzymes. So I have given some proof also. I have taken little more proof you have to add because they have asked about emphasis. The pepper nigram or piperine, how it is interfering, a natural drug interfering with the other drug when they are taking interaction. If you write this very clearly, and also it will be useful for you, I hope. And you see, piperine is a major alkaloid which is present in the black pepper, piper nigram, and the alkaloid is used as a herbal product for its purported specific important anti-inflammatory activity, antioxidant activity, which is very important for anti-cancer effect, anti-tumor property. It is present in piperine. Very, very important of this chemical structure of the piperine which is present in piper nigram. The result of two recent reports suggests that piperine may increase the plasma concentration of carbamazepine and diclofenac. So when you take diclofenac, please avoid taking pepper. Through inhibiting these two CYP3A4 cytochrome enzyme and CYP2C9 respectively. So that causes the increase in the drug which you have taken. The activity may cause in different interactions, may make difficulty to the patients. So black pepper might produce addictive effect with anti-diabetic drugs also and increase the risk of hypoglycemia. The patient may come down the glucose level, may go for a faint. So that's also you should be very careful. Black pepper might increase the blood level of cefotoxin. What is cefotoxin? Cefotoxin is an antibiotic which comes in saffron. That means not saffron. It is penicillin, then ciprofloxacin. That is, for example, it is saffron derivatives. So cefotoxin and cyclosporins. When you combine with cyclosporin, what is cyclosporin? What is cyclosporin? Which is also we have mentioned in the first slide itself, cyclosporin. Cyclosporin is an immunosuppressant. Why you need this cyclosporin for immunosuppressant? Because sometimes a patient with a new heart transplantation or a kidney transplantation or any type of new alteration which you made in your body, your body cells or your antibody cells which is produced by your body should not identify this new organ or new transplantation which you made in the body as a foreign substance, and it should not attack. So that's why they used to use this cyclosporin for immunosuppressants very rarely, and it should be used without consulting. It should not be used without consulting with the doctor or with the specialized. Why it has to be used? But in case an antibiotic like cefotoxin, which contains cephalosporins derivatives, they are cephalosporins derivatives. Penicillin, cephalosporins, then only we are coming ofloxacin, bfloxacin, like that. So cephalosporin derivatives, in that when you are giving with cefotoxin with cyclosporin, which is used for as an immunosuppressant, resulting in increase of drug effect as well as side effects are seen. So black pepper, with black pepper, when you use with black pepper. So black pepper also might increase the blood levels, thereby enhancing the effect as well as side effect of anti-cancer drugs also, and anti-hypertensive drugs, anti-convulsant drugs, and some antibiotics also. So that's why whenever you are giving pepper and a patient who is taking these type of drugs, it is necessary for you to advise them, and their complications should be mentioned very clearly so that it will be helpful for the patient to be safe. And thank you very much for being with me. Go through and get the hard copy and make use of this for your exam.